Good morning. Come on, guys. Good morning. There we go. It's a great day. So we do have several seats still available. Please come forward. I know everyone's being generous and not wanting to take a seat from someone else, but we do have plenty of seats. So please join us here in the audience in the gallery. So good morning again. My name is Tori Bayless, and I have the privilege of serving as the CEO for Luminis Health. And I just want to thank all of you for joining us here. It's a new beginning. It's a historic day for Luminis Health, for Luminis Health Doctors Community Medical Center, and we're so appreciative of the partnership with Prince George's County. So we are honored to welcome many of our legislative, community, and healthcare industry leaders here today, as well as the generous donors from across our region who have helped to make this behavioral health pavilion here at Doctors a reality. We are thrilled. If you think about the timing of this, the construction team and all the work that went into the planning with the clinical operations teams, I would say it's actually a record time that we were able to complete this. So, and by the way, it was through a global pandemic. And the need is great. You know that. We appreciate your support and for being here. The need is really significant. And to be able to accomplish this in partnership with the county through a global pandemic, knowing how great the needs are, again, thank you all for being with us. We will have the honor of hearing from Maryland Department of Health Secretary Schrader. Dennis Schrader is with us here today representing Governor Hogan. But I do want to recognize and welcome many of our officials, elected officials, and community leaders. I want to recognize, of course, County Executive Angela Alsobrooks. Thank you for joining us, and we'll hear from you very shortly as well. Secretary Schrader, again, thank you for joining us. Marshall Henson, thank you for joining us as well with the Department of Health. It's the Director of Operations for Behavioral Health. Delegate Ann Healy, thank you, Delegate Healy, for joining us from District 22. Delegate Darrell Barnes, thank you for joining us as well. Council Member Todd Turner, we'll hear from you shortly as well. Thank you for joining. Dr. Jacqueline Somerville, the Associate Director for the Prince George's County Department of Health. And while he could not be with us, I also certainly want to recognize Dr. Carter for his leadership and commitment to this project. I'd also like to recognize the Honorable Athena Groves being with us today. Thank you, Athena. Athena also serves as a board member for Luminis Health. Thank you for being with us. So I would ask, I may have missed some folks. So while you were waving casually, if all of our elected officials could please just stand for a moment and be recognized. Elected officials and county and state officials. Dennis is being shy. Marshall, thank you very much. I also want to recognize the leadership across Luminis Health and Doctors Community Medical Center. We are very fortunate to have board members with us here today, including the chair of the Doctors Community Medical Center Board, Patricia Arzuaga. Thank you, Pat, for being with us. We also have the chair of our foundation board here at Doctors Community Medical Center, Dominic Magnolia. Dom? Where is he? I'm scanning. Where is Dom? There you are. So, and I would ask that all of our trustees for both Doctors, Luminis Health, and Arundel Medical Center, please stand up to be recognized. What folks have to understand is that we have incredible leadership in these volunteer trustees and volunteer directors. They give countless hours throughout the year to help make this vision a reality. So thank you to our board members. We're also incredibly grateful to our donors. Our donors, many of whom are with us here, significant donors that have dug deep to support this initiative. And we want to recognize Ian Kelly from the Albert Turner Charitable Trust, Renee Levine, who is a board member for the organization. I know Gary Michael is here with us. Gary Michael, thank you. Dr. Sadagian for significant support, as well as we want to thank and recognize Dom Magnolia and the Magnolia Family Foundation, an incredibly generous gift that was provided in the loving memory of Michael Pissarra, whose family is here today. So thank you. And also 4 of his closest friends that he grew up with are here with us as well. Gentlemen, why don't you stand up? We're glad to have you with us today as well. Thank you so very much. So I want to be very clear, and I am so grateful for the support and to thank County Executive Angela Alsobrooks for your unyielding support over the past 2 years to make this vision a reality, as well as the Prince George's County Council. We are tremendously grateful for the partnership in delivering high quality behavioral health services in this community and in this region. So it really is a great day for here, all of us at Luminis Health Doctors Community Medical Center and across Prince George's County as we prepare to open the doors of this new behavioral health pavilion. The very generous support and grant donation of $20 million bringing this project to fruition. To make this funding available is so incredibly important, and it really makes us better able to meet the needs of the community. I had the opportunity to speak with several folks this morning. We all recognize behavioral health services just simply aren't valued in the same way that other healthcare services are. So this grant, the generosity of the county and the county executive are so critically important to us. You know, the statistics are pretty astounding, looking at both the adult population as well as adolescents and children, compounded over the course of this pandemic, compounded in communities all around the country, right here in our backyard. We know from the Community Health Needs Assessment for Prince George's County, this is the #1 need. We're opening up doors, we're creating access. That's what this is all about. We are really grateful, again, for all of you being here with us. When we talk about Luminis Health, which is a relatively newly formed system, just 7 months before we got hit with a pandemic, Luminis Health was formed in 2019 by the coming together of doctors and Anne Arundel Medical Center and our 90 locations throughout the region. So this was a top priority for us. When we came together, we said we needed to bring more access, bring more services to meet the community's needs. So we're really excited about this. And while we'll be having the opportunity to tour the facility on the first floor, which will be opening in just a couple of weeks, we are also continuing the construction on the second floor, which will be our inpatient facility that we expect to open later this calendar year. So without further ado, I am going to introduce a woman who doesn't need a lot of introduction, but I'm a huge fan of hers. We are thrilled to have at the helm of Luminis Health Doctors Community Medical Center, Deneen Richman. Deneen took the helm just a couple of years ago and has done incredible work in fostering partnerships, building the leadership team, and energizing the team members all across this campus and members of the doctors family in the region. So, but please join me in welcoming Deneen Richman to the podium.
All right. Good morning. Thank you, Tori. Wow, this is a wonderful day, isn't it? All right. Can we get an amen, maybe? All right. So, good morning and welcome again to everyone. As Tori said, I'm Deneen Richman, and I'm the president here at Luminis Health Doctors Community Medical Center. And I'm just thrilled to be here. And I'm honored to share this exciting moment with each of you. And I really, again, want to sincerely thank you for being here as well. You know, it's a little overwhelming to be here today, and I'm just filled with pride and excitement that this day has finally arrived where we're going to be able to offer such needed behavioral health services right here on our Lanham campus here in Prince George's County at Luminis Health Doctors Community Medical Center. And again, I absolutely have to thank my friend, County Executive Angela Alsobrooks, and the Prince George's County Council. Thank you, Council Member Todd Turner, for being here representing the council for the very generous $20 million grant that supported this behavioral health pavilion. And we truly understand the strength and the power in that partnership. And we know that as we continue to grow this program and meet the community's behavioral health needs, that we'll be able to continue to count on you and many, many others as our partners. Also, Secretary Schrader, thank you so much for being here and bringing the governor's support today. And, you know, what this really demonstrates is a village, right? It takes a village. We all know that saying, it takes a village. Well, we have a village of partners who are so vital to our success in serving the Prince George's County community with quality, accessible care. And now we can add quality, accessible, safe behavior health care to that equation. and providing those services close to home so that people don't have to leave their community. Our partners are vast. As you've been hearing, it's the county and state behavioral health divisions and leadership, community mental health providers, some of whom are with us today, public safety officials, some of whom are with us today, our entire doctors team, our entire Luminis team, and so many others in the community who are supporting us in this very important work that we're doing. So again, thank you from the bottom of my heart. Unfortunately, when we think about the needs for these services, we know that while it always was already the number one need per the Community Health Needs Assessment, those needs have only exacerbated during this pandemic. We all know that even prior to the pandemic, a number of people who are living with behavioral health conditions were not able to get the care and treatment that they need. So now we'll be able to meet those unmet community needs and also take a giant leap forward in addressing a very important aspect of health equity that is something else that we are very, very much focused on here at Luminis Health. Currently, there are only 2 inpatient behavioral health units in this county of almost 1 million people. In fact, we know that 1 in 10 residents have mental health needs and are trying to get those needs through the limited resources. Many of our Prince Georgians end up having to go far to get those needs, with about 15 to 20% going into Washington, D.C., and others going to other surrounding jurisdictions. We also know that many people who have behavioral health needs, unfortunately, receive their care coming through an emergency room. And that is not the way. Episodic mental health care delivered through an emergency room is not the best way to treat people with those needs. And many of them have multiple emergency room visits every single year. So now with the services, the comprehensive services that we are going to be able to offer here, we'll be able to reduce that dependence on the hospital emergency room being the only front door to access mental health needs. So some of those services that we're going to be providing on this first floor here, and I definitely hope that all of you will stay with us immediately following and join us for some quick tours. But the outpatient services include outpatient therapy and medication management for adults, and then we'll be evolving that to also include children. We will have a behavioral health walk-in urgent care clinic. We all know how we use urgent care clinics if you have a sprain or something else that you're concerned about. Well, many times before people get in crisis, we can intervene and provide them with services in an urgent care setting as well. We'll have a psychiatric day treatment program and a mental health partial hospitalization program and an intensive outpatient program that will serve adults as well as adolescents, an 8-bed addiction residential services, and a substance use disorder intensive outpatient treatment program. And last but not least, as Tori mentioned, later this year, we'll be opening the second floor, which will be our 16-bed adult inpatient psychiatric unit. So if we think about the community benefit, obviously serving the residents of this county is first and foremost what we think about when we think about community benefits. But we also are going to reduce the number of area admissions. We're going to provide access and support services and be able to serve as a connector to other partners in the community. And most importantly, we also added about 100 jobs with a preference to hiring Prince George's County residents that reflect the demographics of the county as well. So we're very, very proud of that. And as the president of Luminis Health Doctors Community Doctors Community Hospital and a lifelong Prince Georgian myself, I am so honored to have this opportunity to serve the community and truly improve the lives of the people who live in this wonderful county of ours. Very shortly, I'll be introducing Dr. Aaliyah Jones, who's our new Executive Medical Director for Behavioral Health Services at Luminis Health. And following her remarks at the end of the program, that's when we'll invite all of you to join us on tours and learn more about all of these services that we're offering to the community. But let me pause at this point and just thank you again. Thank you for joining us in celebration of this great day for our patients, our families, employees, and community. And now I want to invite our she's not a guest because she's part of our doctor's family. So I want to invite our honorary doctor's family member, County Executive Angela Also Brooks to the podium to share some remarks.
Thank you so much. Oh, this is good. Well, good morning, everyone. And I think it bears repeating that the church should say amen this morning, because this is a really, really special day for us here in Prince George's County. I'd like to start by thanking our amazing partners, CEO Tori Bayless. Thank you so very much for your leadership, as well as President Deneen Richman, who spoke like a Prince Georgian. I should say they both have this morning. You can hear the love reflected in the comments, but they and our Luminis family members have been amazing during this time. And I want to thank them so much, not only for leading in this effort, but for the tremendous efforts that they offered during COVID-19. We couldn't imagine better partners than them. We call them day and night. Very often about family members who had to be alone. Some of them were in critical situations in ICU and could not have family members. Some of them were transitioning without the presence of a family member. And we very often called on them to say, can you please have someone go bedside and stand with this individual because their family members are not allowed to be with them. And so I thank them for their heroic efforts, especially during COVID-19. Secretary Schrader, thank you so much also for your leadership. What an amazing partner you have been to Prince George's County. Thank you. Thank the Hogan administration also. They have been our partners not only in this effort with behavioral health, but this administration has recognized the need as well to cure the inequities that have existed in Prince George's County, where healthcare is concerned now for decades, including the cancer center that is coming out of the ground and many other efforts. So thank you. Please pass along our gratitude to Governor Hogan. I have to tell you, we also have a superhero who is present this morning, who we did not have a chance to acknowledge. We do have a real live superhero who is here. President and CEO Kurt Newman, who is here, who is President and CEO of Children's Hospital. I want to thank him for his presence. Tanya Kenlow, Vice President. And when I say superhero, you all think I'm exaggerating, right? Well, I don't know how many of you recall when we had the sniper. And it was who took hold of our area many years ago, and the child who was shot at a middle school, and it was Dr. Kurt Newman who was prepared when he was flown into Children's Hospital, who heroically saved that young man's life, and has continued to save lives of children in Prince George's County and beyond for many, many decades. And so we thank you so much, sir, for your leadership and for being here this morning. I have a wonderful partner I brought with me also, speaking of superheroes, and it's called Super Bad Women, and that is Tara Jackson, who has come, who is our Chief Administrative Officer for the government. Tara, stand up, let them see you, who is a super amazing lady. Who is our Chief Administrative Officer for Prince George's County government, and no one does it better. I can just leave it there. You can search the whole state over, and you will not find an administrator who is as strong as this lady. So thank you so very much. I want to thank also our incredible partners on the County Council. We have here today Councilmember Todd Turner. Want to thank you so much, sir, and thank also our members on the County Council who have been with us every leg of this journey. When we came out in 2018 and all of us talked about what we do about in our next term, we forgot to talk about the pandemic. But nonetheless, they dug in with us, and you will recognize the collaboration and just the unity of purpose that was demonstrated throughout this pandemic was really just unprecedented throughout the state. And it does, I think, explain why the county has been in such good shape, as well as Delegate Ann Healy and Delegate Darrell Barnes. Thank you so much also for their tremendous leadership in bringing back resources. In fact, a historic amount of resources. They brought back the largest sum of state aid ever brought back to Prince George's County this past legislative session 2022 in the history of our county. And so I want to thank them and their delegation for their leadership as well. It has truly been amazing. To our health department, Dr. Belina Shaw, thank you so much for being here. Dr. Shaw is an asset to us and just an angel for us. So thank you and all of our health department professionals for the heroic way that they helped to get us through the pandemic. In his absence, Dr. Carter, I do want to acknowledge also for his tremendous leadership. And to tell you all this morning, you've already heard about the need for this behavioral health center. I think we could go on all morning talking about it, but I think we should suffice it to say our community is in crisis. And we are in deep pain. We are in deep pain. The pandemic, there are aspects of it that were visible to the eye. The business is closed, the schools closed. I think the part of the pandemic that was invisible were the deep and enduring injuries, psychological injuries that happened in our community. And those injuries are showing up right now in incredible ways. Unfortunately, I'm going to be talking when this tour is over today about another child who brought a loaded handgun to a middle school in Prince George's County today. And I have to tell you that the pain, these psychological injuries that happen, most especially to adolescents and in our community, is just devastating. It really is just devastating. And the most injurious, I think, thing that can happen to a person, and the most devastating injury is a psychological one. I just have to say that it really is. It's the injury you can't see. A person with a broken leg, well, then we all understand what needs to happen there. We give accommodations, we give grace to that person. But what happens to a person whose mind is injured, who the world can't see? And that is truly what we have dealt with now and have battled in a long standing way for so long in Prince George's County in a way that has been disproportionate to the rest of the region. Back in 2019, you've already heard that Prince George's County ordered a community health needs assessment, and this assessment identified behavioral health as a leading health priority for Prince George's County's residents. And unfortunately, we know that this has long gone unserved. And Prince George's County, because of that, has been designated as a behavioral health desert. And our residents have struggled to find convenient access to quality behavioral health care here at home for far too long. As you've heard, we have nearly 1 million residents in Prince George's County, but had 2 acute care units, 2 for inpatient care, which is just unbelievable. And as a result, we have more than half of the 1,900 adult admissions from Prince George's County were admitted to hospitals outside of Prince George's County. This problem we know also has bled over into other areas like our criminal justice system, where it has, to me, it just takes all the air out of my chest every single time I say it, that over 70% of the people who we arrest on any given day and take to our local Department of Corrections, 70% of those individuals show up in our prisons intoxicated. And we know that over a third of all of the individuals who we bring to our detention center on any given day are found to have been on psychotropic drugs. So 70% are intoxicated, at least a third of them are mentally ill. And we have decided somehow as a society that we would care for people who are suffering from mental illness and addiction in places where they can't even be healed. And that is the reason why this facility was so urgent for me. It was so urgent for this county council as we looked out about our community and decided that it is immoral to care for people in prison who should be cared for in places where they can actually be healed and where we can stop this horrible cycle that we're seeing of recycling individuals in and about our community who are suffering with mental illness and with addiction. We saw also during the summer of 2020 how the nation was swept up also in a broad, powerful movement to bring about an end to police violence. And we were faced with many of our local residents who were involved with the police department, and we understood that much of this came about because of some of the concerns that we have since this pandemic uncovered. And so we realized that the moment that we were in was filled with new challenges, as well as conditions that had carried over for many years. But within those circumstances, I have to tell you, I'm so just hopeful because in the same moment rose an opportunity that we could not wait to seize. We believe that we couldn't wait any longer for our residents to get the help that they need and to be on a path that was more sustainable for them. So, this is a time we know of great challenge, and it is a time of rising opportunity for Prince George's County. And I can't tell you how hopeful we are, because we know that this is an opportunity that we couldn't wait to take advantage of, and so we did. So when the challenges of the summer of 2020 presented themselves to us, I sent enabling legislation to our county council to shift $20 million from the building of a public safety training facility. And we still have a public safety training facility, but what we recognize is what we really needed was the construction of this mental health facility. The council agreed that this was the right time to act, and they approved the measure to go on the November 2020 ballot. Our residents who have long expressed their belief that behavioral health care is a priority agreed with us, and they acted to vote for this. And so here we are. Our partners at Luminis Health also saw this coalition as an opportunity and agreed that the time was right to act, and they wanted to be a part of this. And so they acted by joining our efforts to provide our residents with the best health care possible. This administration, as well as the county council, the residents of Prince George's County, and Luminis Health are in unison in terms of our vision, and our collective determination to act is what made today possible. Because we came together and decided we could wait no longer, I can tell you that today is a really big deal for us, to give us an opportunity to celebrate the grand opening of this Luminis Behavioral Health Facility, which is the first of its kind in Prince George's County. Now, I say the first, but I want you to know that it is our vision. Yes, thank God. We're on the road. It is the first of its kind, but I can tell you it won't be the last. We are building out a continuum of these kinds of facilities all over Prince George's County. And I want each of you to know, first of all, we thank you all for being here today to mark this important milestone in the health of our community. But I also want to say to all of our residents who are looking out and asking the all important question, what about me? What about my child? What about my loved one? I don't know what to do for this person who I love so dearly. I don't know where to take them, how to get the care that they need. You know, help is on the way. For the parents who are also saying, I'm not even sure that I can discuss some of what is happening in my household with others. You can discuss it with us, and you can bring your loved ones. I'm understanding that urgent care here takes children as young as 4 years old. This is a facility that will also care for adolescents, and so this is exciting for us to be able to get our young people the care that they need and the help that they need, as well as to get our other family members. So again, thank you all so much for being here today. For all of the leaders who made today possible, thank you, thank you, thank you. You know, there's an overused proverb, is an African proverb that I often offer, which is so true, and it says, if you want to go quickly, if you want to go alone, go quickly, go alone. But if you want to go far, go together. And this is one of those days where going together is the only option. So thank you so much. God bless all of you. And what a great day this is.
Thank you so much, County Executive, for those words, those sobering statistics, but then the hope, leaving us with that hope at the end of the wonderful work we're going to do. At this point, I would like to welcome Councilmember Todd Turner up to the podium to join us for some remarks.
Thank you, Deneen. Thank you, Tori. Obviously, for Luminis Health. On behalf of my chair, Calvin Hawkins, my vice chair, Sidney Harrison, and my colleagues on the Prince George's County Council, we bring you greetings and celebration for today. I guess one of the few benefits of being in your last year of your last term is, you know, we have council session today. So I said, hey, listen, I'm going to go to this event. I'll get there when I can get there. But I also have learned some good lessons as a member of the county council, particularly over the last 3.5 years. One is to never follow the county executive in a speech. Done that. The other thing I've learned, I had the great opportunity to be chair of the county council for 2 years, one in 2019 and then in 2020. So I also learned some other lessons. You know, it's a little bit difficult to be a chair when you have a new county executive and the majority of your county council is new. Also, it's very hard to be a county council chair in the middle of a pandemic. But I was able to accomplish those things because of the partnership that we have, not only with County Executive Angela Alsobrooks, my colleagues on the county council, but you here in the community, in particular with Luminis Health. So I always joke, you know, I'm starting to date myself, and this is a hair joke, so I shouldn't really say it at all. But you remember those commercials where the president of the company says, you know, I'm not only the president, I'm also a client. So I can say the same thing, obviously, about using Doctors Hospital here. We've had to use it for a couple occasions in my family, including my mother back in 2016. So I want to thank you for the service that you provide to the community here in Prince George's County. I also want to give a special recognition. Obviously, I do not represent the hospital in my district. I'm literally just down the street. But Councilmember Danielle Glaros, who's another colleague of mine, who's finishing her last term and this year, she would love to have been here. I know she's represented by Wanda Brooks from her office. So Wanda, thank you for being here. There she is. Yep. And I know she's going to need some mental health services when she gets back because she's doing a trip to Puerto Rico with her Girl Scout troop where she's chaperoning. So I think Deneen, she came on Friday. She got some pre-service before she had to take this trip. But I do want to thank Councilmember Glaros for her partnership and her strong willingness to work, particularly with Luminis Health on this project. So, you know, being reflective in my last year, you know, I'm not going to cry or anything like that. Don't worry about that. But what I would say is my motto when I came on the county council was service, community, progress, right? Only through service to your community can you have progress. And I think this is a perfect example of doing that. And I've heard some of the key words that I was going to talk about in all the speeches here this morning. It's about relationships, it's about partnerships, and being able to move this county forward. And this is one of those examples where we took the leadership of Angela Alsobrooks in 2020 to say this is something that we need to do here in Prince George's County. We know that there's a need here to do that. And so I was grateful to be able to work with her as chair of the council, work with my colleagues to get that $20 million set aside and put it on the ballot that November, and obviously being passed by the residents of this county. And now we are seeing the fruits of our labor here today. And I know there's still more work going on for the inpatient, but this is an example of when the old saying is you put your money where your mouth is. And so we did that, and I want to thank County Executive Angela Alsobrooks for taking that faith because, you know, as we're seeing now, public safety is a big issue as well. But because of the conversation that was going on nationally, and I see Chief Aziz is here, our police chief for Prince George's County. Thank you, Chief Aziz, for being here. Of course, he wasn't the police chief at the time, so you know, he probably missed the $20 million, but that's okay. We'll work it out. We'll work it out. But I know I appreciate the opportunity obviously to serve, obviously the last 8 years. This completes actually 17 years in public office between municipal and county work. And so I will simply say the things that we've been able to accomplish together here in Prince George's County and the things are yet to come that we've established and are working towards, I'm really excited in my retirement to be able to see that work going on. So thank you very much, Luminis. We look forward to the continued partnership. And I got to get back to council session because I want to keep my perfect attendance record for my last year.
Thank you very much, Councilmember Turner and County Executive Alsobrooks. You know, we've heard many times the word partnership here, and that is one of the key tenets of what we call our Vision 2030 of Luminis Health, living healthier together. We talk about partnerships. We talk about making robust partnerships. We know we can't do this alone, so thank you for the partnership there. Referenced several times, I just want to take a moment to introduce and welcome Secretary Dennis Schrader to the podium for his remarks. When we think about the partnership with the state, working with the county, working with the municipalities, working with the cities, it's been an interesting journey these past couple of years for sure. And we're very happy to have Secretary Dennis Schrader with us today on behalf of Governor Hogan to offer your remarks. Welcome, Dennis.
Well, it's great to be here. I can't tell you how happy I am to see this new facility coming on board. And CEO Bayless, thank you very much for the introduction, and good morning, everybody. CEO Bayless and Richman, I do appreciate the fact that you've taken a leadership role here in Prince George's County. As was said by County Executive Also Brooks, there's been a great need. There's been some done, but much more needs to be done. And I do want to thank the County Executive. You've been a tremendous leader through this COVID situation. We've been together many times, often with masks on. So it's great to see you today without a mask. But and your leadership in bringing this $20 million is really tremendous. So thank you very much for your partnership. It's been wonderful working with you, and we've got a little while longer to go here. And we're as I've said before, we're going to run through the tape. We're not slowing down. So thank you very much. I also want to recognize Luminis's new Executive Director of Behavioral Health Services, Dr. Aaliyah Jones. And as many of you may know, she was most recently the Deputy Secretary for the state for Behavioral Health Administration. She came to us from Grace in Baltimore City. The minute I met her, I knew she was the person that we needed at the health department. She did a terrific job, and I always tell folks, come for 2 or 3 or 4 or 5 years. Don't feel like you got to stay forever, but if you're really, really good, like Dr. Jones, you're going to make an impact in those few years. And so I thank you for what you've done. And through your efforts, we have Marshall Henson, who's with you, and Marshall's working very hard. We are very committed to finding a path forward to reduce hospital overstays, to find more capacity for adolescents who are hard to place. This is on my mind every day. I know Marshall gets a call from me at least once a day to talk about this, as well as Brian Morose, who's our director of our health system. So on behalf of Governor Hogan, I want to congratulate Luminis Health in Prince George's County. This fantastic facility that's being renovated. I've renovated a lot of facilities in my time, and this is really very nice. But it provides a seamless mental health service to underserved Prince Georgians, and starting this summer for urgent care, and in particular the 16-bed adult unit. As you know, a while back, when the determination through Olmsted was made to move people out of institutionalization, as Lieutenant Governor Rutherford has said many times, we may have gone too far. And the rules are such that it's very hard to get capacity, and we really need to work on that. But 16 beds is the threshold, and we've been working in Medicaid through the efforts of Trish Roddy and others to get the rules loosened up. We've got waivers so that we can bring people into at least 2 30-day stays. And be funded by Medicaid. That's just the tip of the iceberg. And we have to talk more openly about this because we have to address this problem. I mentioned Lieutenant Governor Rutherford. One of the things he's been working on behalf of Governor Hogan for the last 7 years is the Commission to Study Mental and Behavioral Health in the state. We've been all over the state, and a lot of things are starting to happen. As you know, anytime you're trying to move or turn an aircraft carrier, it takes a while, but we are moving now and things are happening. We just finished our master plan, and we are committed to crisis services throughout the state. We're going to be building some crisis capacity in the state. We've already announced one expression of interest out in the Hagerstown area, but we have 3 other areas, and we are going to be putting proposals for the capital budget to move that along. This is historic, and I urge you to take a look at our master plan. I'd also mention that the stress of COVID-19 has been devastating on our children and adults. The stress of whether or not you're going to get COVID, the stress of losing family members, it's been quite devastating, as we all know. And facilities like this are really important to create greater access. The last thing I'll mention is that we are working with 211 to create better contact. We're going to be doing a we've put online, for example, if you go to 211maryland.org, you now can find every mental health facility in the state of Maryland online with their contact information. We are also working with discharge planners in the hospitals throughout the state to learn and get data so that we can focus on creating more access. So I'm going to stop there. Congratulations on this facility. As soon as I got the invitation, I said immediately, this is something that is important and I'm going to be here. So thank you so much, Tori.
Yes. Thank you so much, Secretary Schrader. So hang tight just a minute and we're going to get to those tours. But before that, you just heard Dr. Aaliyah Jones introduce. I'll be very brief. But I just want to, Dr. Jones joined Luminis Health in May. As you heard, she most recently served as Deputy Secretary in the Maryland Department of Health Behavioral Health Administration. She has spent many years at Bon Secours, now Grace, as the chair of the Department of Behavioral Health and the chair of psychiatry. And in her role here at Luminis Health, Dr. Jones will be providing leadership to all aspects of our Luminis Health service line throughout all of Luminis Health. So we're just so pleased and honored to have you with us today.
Thank you, Deneen. Good morning and welcome. I'm glad to be with you all this morning, and you all, I've already been introduced. I want to just acknowledge the many thanks that have been made for the grant that made this project possible and the leadership that brought us to this occasion of standing before this beautiful and dignifying structure that will be a place where the community can come and receive evidence-based and culturally sensitive behavioral health care. That is something to be proud of. Luminis Health is expanding its delivery of high-quality services into the behavioral health system of care in this community to address the many unmet needs that have already been shared. People need access to behavioral health services, and every community deserves to have access to the care that they need, and location of services impacts access. The people of this community have borne a significant brunt from the impact of the COVID pandemic on the state of Maryland. Like most states, the pandemic has had a differential impact on communities of color. And part of that impact has been seen in greater increases in depression, anxiety, traumatic stress disorders, substance use, overdose rates, and suicidality. And yet we don't despair over the future impact of COVID on the behavioral health of the citizens of Prince George's County, because we remember the words from the psychiatrist Dr. Carl Bell, who showed us and reminded us that risk factors are not predictive factors because of protective factors. We aim for this behavioral health pavilion to be woven into the social fabric of this community so that it can become one of the many factors, protective factors, shielding this community from the traumas of the past as well as those of the future. A resource that in partnership with others and other providers in the community will help to close the gaps in behavioral health outcomes and bring us closer to behavioral health equity. This beautiful pavilion is not a place of shame. This is a place of hope and of healing for those who have experienced hopelessness, dis-ease, anxiety, worry, stress, psychosis, and other thought disorders, and excessive substance use. This is a place to find relief by developing a partnership with a clinical team that will validate your experience and help you on your next steps to recovery from whatever behavioral condition ails you. Only in partnership with the community can we ensure that these programs thrive. And I have learned after spending some time at the state that you never miss an opportunity to ask for what you need. And so I leave each of you with an ask. If you provide behavioral health services and you live in Prince George's County, if you are looking for an organization close to home where you can practice your craft, please consider joining our team. And lastly, roughly 75 to 80% of Black and Hispanic people who have diagnosable behavioral health conditions do not receive the treatment that they need. If you or if you know someone who needs assistance meeting the emotional and mental challenges of life, if you need help getting connected to a behavioral health provider or a network of care that will help you to live the life that you are supposed to live, if you need help getting connected, it's time to come out of the shadows. We need you to use the services that are available and to help us to co-create a behavioral health system of care that fully meets your needs in partnership with community providers. Thank you for your partnership and your support, and welcome again to the Luminis Health Behavioral Health Pavilion.
This thing's gonna really cut.
Aleah, which camera are you actually looking at?
Right here. Right here.
Right.
Right here first. Tori, you have to break the scissors too. You make this cut.
You want to look at this camera here first?
Who's gonna count for us? Yes. 1, 2, right here. 3,